Hello, my name is Dr. Tiffany Taft, and I am a clinical psychologist working with patients with inflammatory bowel disease, and I'm here to talk to you about working with the health psychologist to address the complexities of a chronic disease. I am an assistant professor at Northwestern University Medical School in Chicago, where I've worked in the Division of Gastroenterology for the past 14 years. And I am dedicated to working to improve the lives of patients with IBD through both research and my clinical work with patients. I have a couple of disclosures. I've done some speaking arrangements for AbbVie and Janssen for physician and patient education programs. So the objectives today are to understand the value of addressing mental health in IBD and what working with a psychologist or social worker can bring to your IBD treatment. Review of the treatment approaches that a health psychologist or social worker might work with you to help address your IBD issues. And then learn questions that you can ask a potential therapist about meeting with them to work on issues related to your IBD. So many patients will ask, why is my doctor recommending a psychologist for my IBD? This is a real disease. You know, I have symptoms, my pain is real, and I'm not crazy, or my symptoms aren't all in my head. And that's a common thought process that I hear from patients, and the concern that their doctor is giving up on them, you know, or doesn't really believe that their symptoms are as bad as they are. And I want to emphasize to you that while I can't speak for all doctors out there, that the vast majority do not think this way at all. And when they're telling you that they think a psychologist might be helpful, it's because they recognize the interplay between your IBD symptoms and then your social and emotional well-being. So when your doctor talks about this with you, think of it as an opportunity to maybe work on coping or stress management or other things that might be of struggle for you, and as a way to complement the work that you're doing with your doctor. So we did a study that is now published on patient experiences with integrating mental health care into their IBD treatment plan. And in this graph, you can see in the dark bars, the dark blue bars are the percentage of patients that said that their healthcare provider, which was mostly gastroenterologists and some primary care doctors, discussed the topic with them at any of their prior visits. And then in the lighter blue bars, you can see that the percentage of patients that reported that they would like this topic to be discussed. And just by quick glance, you can see there are large gaps between what the providers are talking about and what the patients need in terms of mental health and IBD. If we look across the three that are close to 75 or at 75% of IBD patients want to discuss the impact of IBD on their emotions, the impact of IBD on their mental health as a whole, so how IBD may cause feelings of worry or anxiety or sadness or even depression, and also the impact of IBD on their quality of life. So quality of life means your social experiences, your financial experiences, also some more emotional. So quality of life is a broad topic that's often looked at in IBD, and we know that patients with IBD have reduced quality of life, especially when their disease is active. Unfortunately, there are these gaps between what the patients would like and what doctors are talking about, including between a referral for mental health treatment. So almost half of patients with IBD would like to be referred for mental health treatment, but only 17% of doctors are actually doing that. So we have a lot of work to do to help patients feel supported in this area of their IBD care. So what could a psychologist do for you as an IBD patient? I talk to my patients about all sorts of things. And I want to say that most of my patients with IBD that I see do not meet what we would call the diagnostic criteria for anxiety and depression. Those words are used a lot in the research world, also in some of the materials that have been printed in the past about mental health and IBD. We talk a lot about anxiety and depression, but really most IBD patients don't have clinical depression and anxiety. They may have some symptoms, but overall patients are coming in with questions about navigating the healthcare system, communicating with their doctor. If maybe that relationship isn't going so great, how to make the decision if they want to change doctors or try to, rectify communication difficulties. Coming to terms with everything that comes with the IBD diagnosis, something we call adjustment or acceptance of the diagnosis. That can be tricky, especially in the first year after learning you have IBD. Think of all the information that was thrown at you when you got your diagnosis, and you had to learn about all sorts of things, how your digestive system works, the names of medications, and you're going to a doctor very frequently. There's a lot to do there and a lot to come to terms with, and so a psychologist can definitely help with that. We also do work if there is depression or anxiety or even something called post-traumatic stress disorder, which is typically thought of in people who have, say, gone off to war or been in combat or maybe been a victim of a crime or in a really bad car accident. But we know that patients with chronic illness, severe illnesses, especially those that have surgeries or hospitalizations, can develop PTSD as well. And so we are actively looking at PTSD in IBD, looking to see what might cause some patients to develop that. Also looking at interpersonal relationships, social relationships. A lot of patients get worried about being a burden or being able to go out and, meet their social obligations, going to work. I would say that's where most of the anxieties are, the patients that I talk to, and just helping cope with that. Think about how you're approaching things. Maybe there are other ways to look at situations that don't leave you feeling as socially isolated or disconnected from others. We also do a lot of work on stress management. We have pretty much decided in the research world that stress will affect IBD. This was an area of debate for a little while, but we do know, especially as research is looking at the gut microbiome or the bacteria and viruses and all those things in your digestive system and how that affects IBD. We know that stress affects the gut microbiome. And so we need to, as IBD patients, learn how to manage our stress better than the average person. So it's not saying that IBD patients don't know how to handle stress, quite the contrary, but they have to have even better skills sometimes to keep their symptoms from flaring up during periods of stress. So I want to address really, and a really important topic, the all in your head thing that comes up a lot. The things that are not in your head are your symptoms, your pain, the side effects of the medication that you're having, the insomnia, all these things that come with IBD. They're not, quote, in your head. But what is in your head, and we have to acknowledge this, is the worry that you might have about symptoms, or the sadness that comes from living with chronic pain, or the fear of side effects, or the response to the stigma that can sometimes come with IBD. So those are the areas when we say all in your head that we're talking about. That doesn't mean, the other things, the symptoms and the pain are not real at all. But if I can help the patient in how they think about their situation, sometimes that can reduce some of the symptoms and pain, and then obviously also the anxiety and worry that goes along with IBD. So going back to the study on IBD patients and wanting to have integrated mental health care, we asked patients about what are the main barriers that you see in getting access to mental health care. And the number one reported reason was the high costs of therapy, followed by the lack of therapists who understand IBD and inadequate insurance coverage. These aren't necessarily unique to IBD therapy, but I do want to talk about some of these and provide some information on insurance coverage and things like that. So the good news is that insurance, or at least most insurance plans, private insurance plans, will cover seeing a counselor, a psychologist, or social worker for IBD. We've had a lot of evolution in mental health coverage and insurance in the United States in the last few years, and I rarely get a denial for coverage for a patient with IBD. So you can call your insurance company, call the customer service line, and ask specifically about mental health coverage. You can even ask about certain codes used for therapy, and they can give you that information up front so that you know what they're going to pay. Most of my patients have a small copay associated with their visits, assuming their deductible has been met, just like with their gastroenterologist. The other one that was striking was the lack of therapists who understand IBD, and we are working on training more and more therapists to at least be familiar with IBD. They don't need to be experts per se, but really just to have a basic understanding so that you, as the IBD patient coming in for treatment, don't have to spend the first 3 visits teaching them about what anti-TNF medications are, or what the basic symptoms of IBD are. The good news is there are many psychologists and social workers out there already who are trained in working with patients with chronic medical illnesses. I am a health psychologist, which means I specialized in working with patients with chronic illness, and there are also medical social workers. So they exist already. We just need to bring their attention to gastroenterology and working with IBD patients that tend to work in other areas such as cancer, obesity, and things like that. So we are aware of that, and we are working to train more therapists to fill that gap. The last is the therapy costs, and there is definitely a considerable expense associated with therapy most of the time. You can ask therapists about things like sliding scale fees, which means that we will reduce our fees to forego economic burden that may happen from coming in for multiple visits to a therapist. So we are in our ethics code for psychologists. We're told that we should do that for at least some of our patients, and most therapists do, but some don't. But you should be able to find someone that will hopefully work with you on costs if your insurance isn't covering like you would like it to, so that you still can get access to the treatment. So what does coming in to see a psychologist look like? The first visit we call initial consultation. So basically when patients come in to see me, I ask them about how their IBD is affecting their day-to-day life, including the treatments, things like side effects, how your day-to-day life affects your IBD. So it's a two-way street. And then your goals for treatment. So I really delve into what your situation is with IBD. I don't get into some of the more traditional things that might come up in a regular therapy session, in-depth mental health history and things like that. If it's relevant, it'll definitely get talked about. But overall, the focus will be more on your illness and how it's affecting you and how your life may be affecting your IBD. Treatment with IBD patients, we tend to aim for a short treatment time if possible. So gone are the days in psychology of meeting with your therapist for 10 years. We tend to try and get people through treatment in about 6 months, sometimes shorter, sometimes longer. It really is individualized to what you need. We're not going to tell you that you're done before you're ready, but we also want you to learn the skills that you need to almost be your own therapist and go out in the world and do what we teach you and integrate that into your life and how you're living with IBD. So it will vary, but we try to keep it as short as possible. Typically, we see people once a week, but we can see people every other week. That's usually just as successful. And then after you're done with treatment, you're always welcome to come back with what we call booster sessions. So if you go out into the world for a few months and you're finding that maybe you need a little bit more help in a certain area, you always can come back in and work for a few more sessions with your therapist to try and fill in some of the gaps that you might be experiencing. So what does work? There's a lot of research on this in IBD, and there's some controversy as to which is the best approach. But we do have evidence or data on these 4 main areas of therapy or psychological approaches to helping people with IBD. So the first is cognitive behavioral therapy, or CBT. You may have heard of. It's one of the more popular approaches to psychotherapy these days. And we do know that CBT, specifically with IBD patients, helps improve quality of life and coping skills. It helps people to adhere better with their medications if that's an area of struggle, and it also can help reduce an anxiety and depression, which we would expect because CBT was specifically created back in the 1960s to treat anxiety and depression. So that's the good news about CBT. There's also something called gut-directed hypnotherapy, which always gets an interesting response. When I mention it, it is not like the stage or television or movie hypnosis that you see people running around acting like dogs or chickens. It's not that exciting. It is basically a deep relaxation exercise. So if you've ever done any meditation or guided imagery or even just listen to soothing music to help yourself relax, it kind of falls in that area. But we do something where we talk about your immune system function, your colon and your gut function. And there are studies on gut-directed hypnotherapy that find that it can reduce mucosal inflammation through various immune system pathways. It can prolong clinical remission by about 2.5 months. That was a study we did here at Northwestern with patients with ulcerative colitis. In other studies, 1/4 of patients maintained their remission for up to 5 years after the study was finished. And then another study, 2/3 of patients did not require any more steroid therapy after 5 years. So hypnotherapy became a bit of a steroid-sparing treatment, if you will. So not a lot of research on this, but the studies that have been done are pretty promising. The good news is there's no side effects and there's no risks to doing this treatment. It's just a question of if it will be helpful. The next treatment is mindfulness-based therapy. Mindfulness is quite a bit of a buzzword these days that I see often on social media and on TV shows, but it is also based in science and has been around a lot longer than it's been showing up in those areas of our lives, and it is shown to also help with anxiety, improve quality of life, and depression, which again, it's been doing for a very long time, even before we applied it to IBD. So that's a nice option as well. The last is something called psychodynamic or interpersonal therapy. When I say psychodynamic, that is an older method of therapy that is more driven by theories of Sigmund Freud and his followers. There's only been one study, and it didn't really show any positive effects. So I tend to not recommend psychodynamic therapy for patients with IBD. It really is not going to get at the topics and concerns that IBD patients have. You're welcome to do it if you like, but if you're really looking for working on your IBD alone, I would recommend the first 3. So I personally use a lot of CBT. I also do hypnosis and use mindfulness, but I really like the CBT model for IBD. And the basic idea is that our thoughts influence our behaviors and our emotions, and also can influence our physical sensations. So this is a nice graphic of the cycle that we can get into between these 4 things. And so a common thought that I hear from patients with IBD is people might notice if I'm in the bathroom for too long at a party, or, if you're at a party with one bathroom, there's a line of people out the door. That's a common concern that I hear from patients. So a lot of people will avoid eating at the party. They may not even eat that day, to try and avoid needing to use the bathroom while they're at the party. Unfortunately, these thoughts and even the behavior of not eating can ramp up emotions of anxiety, embarrassment, and shame that in turn can send signals down to our digestive system that can cause stomach pain or tightness in the abdomen, nausea. The brain-gut connection is what I'm talking about here, and the simplest explanation of that connection is when you are nervous and you get butterflies in your stomach. That is something that everybody experiences. That's the brain-gut connection. In IBD, unfortunately, that connection can trigger IBD symptoms like diarrhea and pain. And so if you get those symptoms, it goes right back into your thoughts of, see, I knew I was going to feel bad at the party. I never should have come to the party. And then we go right back around in the circle again. So that can, really cause a lot of problems in how you go about your life. And so that is one thing that in CBT we would work on changing. So I wanted to talk about some expectations to set before you go into therapy. And I want to emphasize an unfortunate statement is the first one, is that many times people often feel worse after they start therapy before they feel better. And if you step back and think about it, it's because you're facing things, fears, anxieties, sadnesses that you have maybe been avoiding, through various means. So when I come to you and say, okay, I want to talk about these, I want you to look at these and really start to pick them apart, that can make you feel worse. But we assure you that you will start to feel better soon. Effective therapy involves working on things that you talk about during your visits and the days in between. So I often say to my patients, you see me 1 hour out of a week, so you have 6 days and 23 hours when we are not together. And if you don't work on anything that we've talked about in between, things are going to go a lot slower. So a lot of therapists especially who do CBT, will assign homework, which is not the best term, but that's what we call it. And it's to really exercises for you to do at home to reinforce what we talked about in the visit. The more open and engaged you are, the better, its effect will be, being honest, talking about things within reason of your comfort, and just really being engaged versus going begrudgingly, will definitely lead to better outcomes from the treatment. With that being said, to be open and engaged, the therapist needs to be the right fit for you. And this might not happen the first time, and it's okay to switch if you don't feel comfortable. I think, compared to going to a gastroenterologist or a physician, while that relationship is definitely important and based on trust and comfort, in therapy, it's at a different level of need for that comfort to be there because you're talking about sensitive topics. And so if you go in and you meet with a therapist a couple of times and your gut is just saying, this person just doesn't fit with my personality, I don't like their style, I don't like what they're saying, it's perfectly okay to switch and find someone that is a better fit, because we know from the psychology research that the number one predictor of outcomes in just psychotherapy across the board, not just in IBD, is patient and therapist fit. So when considering your options, we see pros and cons to meeting with someone like myself, a psychologist, and the interventions that I give do offer direct non-drug strategies to reduce stress, whether it's daily hassles, major life events, and how those affect your IBD. So we know that these treatments can be effective for several things, and there's no side effects. The downside of coming to see a therapist is that it takes practice and motivation. It takes time. You have to really be invested in the treatment, and there is that lack of trained GI psychologists. So thinking through those positives and negatives of seeking therapy, I would argue it's still the positives outweigh the negatives. But I do want to be mindful, that it's not the easiest treatment in the world. But if you are able to find someone that is a good fit, it can really help you in your life with IBD. So a lot of IBD patients will ask, when should I seek help? And I think, patients sometimes wait too long, or physicians wait too long to refer someone or bring up the topic, and then people are being sent to myself and my colleagues when they're in an acute, depressive episode, or their anxiety is so high that they're not going out, they have panic attacks, and we don't want people to wait that long. We would rather you come in early on, even, within a few months of being diagnosed. That's a very critical time for IBD patients to adjust, and we certainly can help you adjust in your early days of IBD. But even if you've had IBD for 15 years, if you're struggling on your own, all the things, your usual tricks for relaxation or stress management or coping just aren't working, that's when I would say to consider reaching out to a therapist. And as I mentioned before, most insurance will cover this without limits, but you need to check with your insurance provider. And also ask any potential therapists that you find. There are some databases online. Psychology Today has a great therapist finder where you can search through different zip codes and narrow it down. Chronic illness is one of the boxes you would want to check to get some of those clinicians that at least know how to work with people with chronic illness, if you can't find one that works with IBD specifically, and really ask them, some questions. Any good therapist will talk to you on the phone before you come in, so you can kind of screen them for fit. And you can ask them, have you seen any patients with IBD? What's your experience in general working with people with chronic medical illnesses? You can ask those types of questions up front before you even schedule the appointment. And as I said before, successful therapy really is based on that good fit between you and your therapist. So I kind of got into these a little bit already, but the questions to ask your potential therapist, outside of their experience with IBD and chronic illness, is what's their treatment approach. So do they use CBT? Do they use mindfulness? Do they use psychodynamic treatments? A lot of therapists will say they're eclectic, or they borrow from multiple schools of thought, which is fine, but you really want to ask maybe what their primary way of thinking about their patient's issues is, to try and get them to tell you a little bit more detail. You can ask about fees, whether they accept insurance. It will vary. Some therapists do accept insurance. Some will accept one or two plans. Some will accept all of them. And then there are some that are only self-pay. So you really want to find out what their fees are, and then if they accept insurance. And then also asking, how will you work with my gastroenterologist? How will you coordinate care? Because the whole point of this is to make sure that care is coordinated but we do need permission from you to talk to your doctor. So that's really up to you. Most patients do want me to talk to their gastroenterologist. So how will you do that? How often? You know, what information will you talk to them about? So self-efficacy is a term in psychology that means my confidence in my ability to do things. So we want patients with IBD to feel confident in their ability to manage their disease, and that includes managing their mental health. So talking to your doctor about the treatment plan that helps you is vital, and feeling like you can have that conversation with your doctor to not just talk about your medication treatments, but also to talk about the possibility of integrating mental health treatment into your care. Also talking with your family and friends about your IBD so they better understand what you're going through, how to support you. Sometimes IBD patients don't want to talk about their illness because it makes them feel like they're being more of a burden. But if people generally don't understand, then they may, say things that aren't the nicest or come across as the nicest, even though they may be well intended. So opening up and talking to them in a way that you're comfortable is helpful. Seeking support, again, from a therapist who knows about IBD. If you can't find a therapist or you're not really feeling going to a one-on-one, you can join a local support group. The CCF certainly has many across the country, and some hospitals, university hospitals will also run local support groups that you can join. Connecting with people through the CCF, through their website, and other patient programs that they have is another great way to take care of yourself when living with IBD. And lastly, maybe consider becoming an advocate for yourself and others living with IBD. There's a wonderful patient advocacy community on social media that you could connect with and share ideas and brainstorm ways to not only improve your own well-being, but the IBD community as a whole. So as we wrap up, I just want to go over 6 important takeaways. And I think the one that I want to emphasize the most is that we have come a very long way in how we understand psych and IBD. The history of psychology and psychiatry in IBD is a bit rocky, and I want to emphasize that those days from maybe the mid-1900s are no longer how we look at psychology, psychiatry, and IBD. We know that emotional impacts are consistent over the entire course of the diseases, and they can be independent of if you're in remission or not. So we do look at, are patients in remission versus not, and how are they doing in terms of things like quality of life, anxiety, depression, etc. And there's definitely improvement with remission, but the things will still linger and affect people in their day-to-day lives. So it doesn't necessarily mean you're going to be okay across the board, even though you've achieved remission. Intervening before your emotional state becomes overwhelming will help us get to the best outcomes with you. So again, not waiting too long to come in on your own or to talk about mental health with your doctor. And 3/4 of patients, IBD patients, do want this talked about at their appointments, and there is that gap in that conversation. So for now, it may be up to you as the IBD patient to start the conversation as we work on getting our GI doc peers up to speed as well. There are several proven treatments, and most are covered by insurance. And there's definitely a demonstrated need for more qualified IBD knowledgeable mental health clinicians to address needs, and myself and my colleagues that work in IBD are aware of this, as I've said, and we are working to bring more clinicians to the CCF to be able to share with their patients to have access to these services.